Strains. So,
strains are like less bad, but they can be as bad.
They can be horrible. So strains are excessive stretching of your muscle.
Of a muscle?
Yes.
Of a muscle, that's important. And strains, muscle.
Yes. And they stretch. And it stretches your muscle beyond its capacity. And so then you bleed into the tissue and you get inflammation.
And it hurts. And you should rice it. You should rice it.
You should rice. What does rice mean, Ashley?
You know what, Christopher? I'm glad you asked me that because it means rice. It doesn't mean anything to do with rice. I don't know. I was going to make R rice, but it's not. It's rest. R is rest. I is ice. C is compress. E is elevate. And how long do we want to use ice for, Christopher?
You want to use ice for the first 24 hours, but not consecutively.
All the time.
Like on 15 minutes, off 30 or so, and then back on.
We don't want to cause vasoconstriction.
Right. Well, yeah, we do.
Well, we do.
Unless you have
sickle cell.
Or the other one. The
compartment syndrome?
Compartment syndrome.
Right. Okay. Yeah. Well, we'll get to that later.
Anyway. So yeah, if you get a strain where you stretch the muscle too far, you want to rice it, RICE it. In a first degree strain, it's like minimal, pretty second degree strain,
Do you think we need to know all of those?
Maybe not.
Probably just like first is not that bad, fourth is worst.
There's no
worst. Well, okay, if there was a fourth, it would be awful. Awful.
First or third.
First or third.
Yeah.
Okay.
Third,
probably.
Third is whenever you've actually separated muscle from muscle.
Oh!
Or muscle from tendon, or tendon from bone. So it's like completely come apart.
Oh,
it's
God!
Moving around.
So painful. I don't know. Personally.
They need to go to PT and an ortho because you can't.
Because that is some serious shit.
Yeah, you can't do anything.
Oh, maybe we shouldn't say that anymore. I apologize. I won't say anymore.
We probably will say.
I mean, it might happen.
Sprain.
Okay.
So you sprain. Whenever you sprain, you have a tear in the ligament. And
I was going to say tendon, but I'm wrong. It's ligament.
Yeah.
It's a tear in the ligament.
And movement is painful because the blood vessels are ruptured.
Oh,
yeah. Like whenever I pushed Ashley down the stairs, I
probably have
some sprain.
All of these. And contusions.
Yeah.
Which, there's a card in there about contusions, but I don't remember talking about them. I think they're just, like, really bad bruises.
I think contusions just at first. Yeah. So, first degree, you can have first and third degree again. First degree, you just tear a little bit. All the way to third degree, you, like... Yes. Complete separation of your ligament from your bone.
Bad news bears.
You have, like, significantly reduced your mobility in that arm. The other two, you can still kind of move it. The third, if you get a third degree, you can't. They'll need to see a specialist, of course. And you could have some residual instability even after you're all patched up. Yeah. So,
not good.
Yeah. Stable fracture versus unstable fracture, pretty self-explanatory.
First of all, a fracture, when you break a bone, just the clinical terms are like, even just like a little itty bitty break. Like, I didn't do that. That wasn't me that hit the mailbox break. I don't know how that got
Yeah. So you can have stable and unstable. Stable fracture is
confined inside the skin, right?
Well, it could be.
It could be poking out.
Yeah. It just stable is just like it's not gonna.
There's no pieces of bone floating around in there.
Yeah.
That's very misleading.
It is.
I disagree with that. I'm going to pick that up with the American Medical Association.
And it can be normal stable fractures or transverse, spiral, or grain stick fractures. And unstable fractures, something is grossly displaced. Now, if it's that grossly displaced,
if my humerus was sticking out of my skull right now, unstable.
Yes. And
comminuted?
Yeah, or oblique.
Okay.
Those are the kinds of fractures.
Those are hard words.
Yeah. Fracture healing. We'll go through this really fast. Be ready. Here we go. First there's the hematoma. Then there's granulation tissue.
Then there's callus formation. Then there's osteoclast activity.
Mm-hmm.
Osteoblast activity.
Ossification, yeah.
Yeah, I mean, I like to get a little more.
Consolidation and remodeling. Yeah.
So, you built a house, now you gotta remodel it. You're not happy with what you did the first time.
Complications of fractures.
One of these is Christopher's favorite.
Hell to no. You can have direct complications, which are infections, disunion, and avascular necrosis.
Which sounds pretty bad.
It's really fun.
Oh,
yeah. I like to do that on my weekends. I just get
avascular necrosis.
on my time off.
Mm-hmm. Yep. And then we just breathe a little and it's good.
Yeah.
Good.
Indirect complications. You can get compartment syndrome, which we'll talk about in a little bit.
We keep telling you we're going to talk about it. You must be just sitting on the edge of your seat. If you're even watching now.
Right. DVTs, fat embolism. Yeah. And traumatic or hypovolemic shock. So here we go. Guess what is next? We've alluded to it.
Yes. Yes. Is it? Could it be compartment syndrome?
Yes. Okay. So compartment syndrome.
Oh my god, you guys should see the back of this card.
It's a lot. But there could be some questions about this. I think there were a few on the last test. It's a little bit important. Hold on.
Are we still here?
We are.
Oh, we are. Okay.
Sorry.
I think there were on the last test.
There were a few. So basically, compartment syndrome.
Do not elevate the extremity above the heart.
Right. Don't. It's whenever you have elevated intracompartmental pressure within a confined myofascial compartment, and it compromises the neurovascular functions of tissues within that space.
So basically.
Right. Basically, there's a lot of pressure in
like you blew up that body part like a balloon.
Right. And then all the little
capillaries in there.
Yeah, they get squeezed, so blood can't get through them.
Mm-hmm.
And then if you don't have blood, then things die.
Like if you were wearing really tight jeans. Yes.
They have to
be really tight. Like get those off.
Yeah.
You're not fooling anyone.
And
you don't put ice on compartments.
Right.
Because it makes that vascular tininess that's worse. It makes it worse.
Yeah. It constricts.
I need to learn how to use my words.
Let's see. If you have a decrease in compartment size, it could be because of a restrictive dressing, or cast, excessive traction. If you have too much weight on the traction, or premature closure of the fascia. And an increased compartment size would be bleeding, leaking something. Yeah,
all of that.
Dr. Pepper, whatever, into the cavity.
What do we do for compartment syndrome?
I'm so glad you asked, actually.
Yeah, because I think there's a card right in front of me.
Yeah.
Yeah.
Let me tell you.
Not ice, not elevating above the heart.
Right. So first, if I thought you might have compartment syndrome, I would check for these 6 P's, which are, yes, they are paresthesia,
prancing.
Yes, if you're prancing, you might have compartment syndrome. Also, that's the 7th P.
Parlor music.
That's the little known P. Okay. So seriously, the real P's are
pain,
yes,
paralysis, pallor, paresthesia, pressure, and there's another one, pulselessness.
Yes.
Pulselessness.
So, if you have pain, it's actually going to be distal to the injury. It's not going to respond to pain medication, and it's going to be, whenever you do passive muscle movement, you're going to, that goes through that muscle, you're going to have some pain with passive muscle movement.
It's going to hurt.
Yeah. So, I would check. If I thought you had compartment syndrome, I would give you a little neurovascular